The entire world suffered. There never had been anything so fierce. Other plagues were local, whereas this one involved the entire world. No, this is not a description of COVID-19. It is about the Black Death from this 700-year-old book. With the chaos and tragedies ensuing from COVID-19, I felt the need to step back from the present and turn my attention to history. Perhaps there was something to be gained by analyzing the plagues of our past. This thought steered me to Stanford Special Collections, a unique library housing thousands of precious rare books, manuscripts, and other archives. As I, a pre-medical student, sat in Stanford Medical Library, my mind raced as my eyes scanned down a rare copy of Guy de Chauliac's book, Chirurgia Magna, so carefully preserved for posterity. It was a privilege to be able to read, with aid of an English translation, the thoughts and lessons from one of the world's most profound medical practitioners, university professor and surgeon of the 14th century, Guy de Chauliac. His story revealed uncanny similarities from today's society and that of the 1300s. As I read, I realized that healthcare heroes then were not so different from how they are today. Although it may seem like the COVID-19 pandemic is a novel experience, pandemics have been around since the beginning of humanity. The Black Death, while being the most fatal pandemic in human history, left behind incredible first-hand accounts that can be studied and learned from. Guy de Chauliac lived an interesting life. He grew up to study medicine from the masters at Montpellier, Bologna, Paris, and Avignon. At the time, the fields of medicine and surgery were distinct, with physicians practicing medicine and barber surgeons practicing surgery. Guy completed both. His reputation grew rapidly and was soon considered one of the most distinguished surgeons of the Middle Ages. When the Black Death reached France in November of 1347, Guy was Pope Clement VI's chief physician. Guy describes that the Black Death envenomed the air and tormented society. The nobility in fear shuddered themselves. Many were at a loss as to the cause. Some towns blamed the Jews for poisoning the world. The guardians of the city gates blocked the entry of strangers. Not only was his society's response similar to ours, isolation, ignorance, blame, and closing borders, but the medical community's heroism was evident as well. The plague doctor, as depicted in this image, looks daunting but served a noble purpose. The uniform was their version of personal protective equipment and enabled physicians to safely care for their patients during the Black Death. The long, pointed beak-like mask was stuffed with fragrant herbs to obscure unpleasant odors. The wax robe and gloves provided a protective barrier, and the cane served as a measure of safe distance from the patient and as an examination tool. The 21st century COVID-19 physician also wore PPE in the form of an N95 mask, face shield, head covering, and protective gown and gloves. Plague doctors mostly received a bad reputation, partly due to lack of effective treatments and use of various ineffective and even harmful methods, including bloodletting and applying human excrement to buboes. Additionally, many medically untrained people used the plague as an opportunity to profit, selling ineffective potions and special treatments to the wealthy. During the Black Death, the worst of humanity was brought out, but in some cases, the best of humanity was too. Prominent physicians issued information and instructions via plague treatises aimed to educate the public. The beginnings of a public health movement sprouted. Physicians were out in communities and people's homes trying to make a difference. Despite having little medically correct knowledge, many physicians still risk their lives to help patients. During COVID-19, we witnessed many similar trends. We received conflicting messaging from various government agencies that caused confusion. Some individuals promoted unproven cures and remedies without scientific merit. However, just like during the Black Death, physicians took lead on the front lines to not abandon, but heroically take care of the most vulnerable of society. Guy describes that the best preventative is to flee the region where the plague is flourishing, yet he himself never kept away. Instead, Guy stayed behind to take care of his patients, including the Pope, not leaving his side when the Pope contracted the plague. Guy's direct disregard for his personal safety in an effort to save others is the definition of a hero. Understanding the importance of isolation, he advised the Pope to stay alone in his chambers and not let anyone in. Additionally, he detailed precise and accurate accounts of symptoms and treatments. Courage is not the absence of fear, but the triumph over it. Guy's courage was evident. And although I was fearful for my own welfare, I persevered with the treatments of my patients. Nevertheless, toward the end of the plague, I fell victim to a continuous fever. I was sick for 6 weeks, and all my associates feared for my life. I treated it, and I survived, as God willed it. Others were not so lucky. Just 2 years after the plague's outbreak, Venice was down to just one physician out of their original 18. In 1363, when the plague returned for a second wave, Guy published his medical book, Chirurgia Magna. He went further than simply describing the medical facts of the Black Death. He provided a deep and introspective account of his personal journey, choosing to stay behind for his patients, contracting the plague, and ultimately overcoming it. He envisioned his medical book to fill the void as a comprehensive medical reference. His motivation was to unify and find a useful concordance, as none of us had at hand all of the books, and none of us had been able to read them all cover to cover and to remember everything. As books during Guy's age were reproduced by hand, a laborious process, medical books were extremely valuable and passed down. Guy's own library included works from generations before him, including Hippocrates, Galen, and Al-Quran. Understanding the legacy his own book would have, Guy intentionally included his personal vivid description of the plague and story of sacrifice, humanizing the medical expert. Knowing his book would be studied by the young medical students of Montpellier and the world for generations to come, Guy used this platform as an opportunity to exemplify what it means to be a physician. His vision proved true, with Chirurgia Magna remaining one of the most influential surgery textbooks for more than 3 centuries after his death, and being translated into numerous languages. As we approach year 4 of the COVID-19 pandemic, we recognize similar patterns of heroism emerging. Flash forward 700 years, and thousands of healthcare heroes, physicians, staff, and nurses are on the front lines combating a novel virus. More than 3,600 United States healthcare workers lost their lives in the first year of COVID-19 alone. From the beginning of humanity, we have been cursed to endure pandemics, and epidemiologists are confident that they will continue to resurface. When novel infections strike society, it would be of immense benefit to apply lessons from previous mistakes and successes. There is hope. Today's researchers collect data, analyze trends, and publish findings in record time. The medical community has rapidly gained understanding in disease prevention and treatment. These accounts and conclusions will help us when the next pandemic arrives. In the preface of his book, Guy reminds us of the potential for growth by building upon the great scientists and surgeons that have come before us. We are like children perched on the shoulders of giants. We can see what they see, and yet somewhat further. Exiting the library, I watched medical students, physicians, and staff, equipped with N95s, walking briskly with purpose towards Stanford Hospital. I'm hopeful that their experiences and stories will be penned down for my generation to study and build upon. Resilience of the human spirit is alive and well. The strength and courage shown by medical professionals today emulates the unbelievable heroism displayed 7 centuries earlier, during the Black Death, the birth of the healthcare hero. Thank you.